All right. Can you guys? Well, great. Thank you very much for having us today. Very much appreciate it. I'm going to spend a little bit of time today talking to you about Seamless Health. Seamless Health is a innovative health plan that was created to provide exceptional health benefits for employees in the multi-unit franchise space, as well as other industries. We really believe that with Seamless Health, employers are able to increase employee retention, save the employer money, and provide best-in-class health benefits to their members. So clicking on here. So what is Seamless Health at its core? Seamless Health is a modern-day health collective whose purpose is to provide all access, accessible, and inclusive and affordable healthcare to our members. We use technology to provide these experiences, and I'll talk a little bit in detail about how we do that here in a few minutes. Seamless Health was actually created by a multi-unit franchisor who was really tired about the old way of providing health benefits in this space. We all know that offering benefits to employees in a high turnover environment have exceptionally high cost, limited options, and very little ability to provide benefits in a streamlined manner. What we have done is we've actually taken these pain points of our founder and managed to develop a plan that really addresses these pain points and provides, again, a tool that can help your employees increase engagement in the organization, as well as provide a productive and successful workforce, which would then drive your business forward. So as I mentioned, we have taken over 100 years of experience in this industry. Our multi-unit franchise founders have quick service restaurants with over 400 locations, bringing together that knowledge with a leading industry leaders in the insurance benefits. We've built a model that's really based on a concierge approach to health benefits. So what does that mean? As we all know, traditional health benefits are a very complicated model. There's a lot of movement, a lot of back and forth between various providers, and often difficult for many employees to navigate. With our solution, we've created a model that is centered around a concierge that brings a centralized point of contact to help you navigate the health benefits. In return, this concierge is also able to help us navigate and direct claims to the appropriate sources to help save the brand from unnecessary claims, as well as help control the cost of the claims that are coming into the plan. Seamless Health is all-inclusive. We provide a solution that is comparable, if not better, to the traditional health benefits that are offered by the Blue Cross Blue Shields, the Aetnas of the world. We provide full primary care, physician services, pharmacy services, emergency room coverage, as well as hospitalization and specialty care as part of Seamless Health. So as you think about this plan, it's very well tailored for the types of healthcare needs within the multi-unit franchise organization, as well as for the franchisors. So with our plan, as I mentioned, the concierge is truly the core of the plan. As we think about healthcare today, and we've all gone through this, you try to find a doctor that's willing to help you with whatever issue you have. You often have to go find the doctor yourself, navigate the benefits, ensure that they're in network, make sure that they accept your insurance, and then work to get scheduled. With Seamless Health, the solution that we have put together is a all-inclusive solution in which our concierge answers the phone for any of your employees, and we're able to provide them the specific benefit that they're looking for at that point. So for example, if your members are now looking to visit a urgent care, our team can help them find that urgent care that best fits their needs, that's closest to their home, and then provide them access to a physician that's within the claim fund. With this solution, our members have seen reductions in their premiums by over 40%. We all know with the hiring world today and the challenges that we face, this is very important to offer a competitive benefits package. And we truly believe that the all-inclusive nature of this plan can do that. A little bit more about the plan. Not only does it include basic health coverage, we've also built in advanced services that are often needed from employees in high risk environments that are non-traditional in nature. We offer not only behavioral health services, facilities and labs management, opioid and addiction assistance, as well as a full list of benefits when it comes from a claims management perspective. This is very important for the employer, as employers would then use this service to be able to really control their cost. So what does that mean? We all know employee wellness is top of mind for all of franchise benefits products. You know, we really want to make sure that the employee has 24/7 access to care. But more importantly, you know, we want to make sure that they've got a holistic approach to their care. We've got, you know, a full medical management team that would then assist with the coordination of that care. And with that care, as I mentioned earlier, we really have the ability to control costs, which I think is, you know, really the crux of the plan. And so as we talk about the plan, you know, what is the benefit to an employer? You know, it really does allow us to provide fully compliant plans that fit the need of various businesses, as well as allow for the employees that are looking for these plans to actually afford the plans. I think, you know, we've all been in scenarios in which, you know, discussing health benefits, it's generally available kind of to the top tier employees. You know, if you think about some of the hourly employees and, you know, their ability to pay into some of these plans, the costs do get very, very expensive. With Seamless Health, the health benefits packages that we offer have shown about a 40% reduction in health benefits and premiums to our franchisors that are taking the plan, which in turn allows for higher participation as well as higher customer retention and employee retention due to the reduced turnover. An example that I like to share around this specifically is of a franchisor that came to us from a Blue Cross and Blue Shield. They were paying well over $700,000 annually for their health benefits. They took on the Seamless plan in January of last year. We saw about a reduction for those employees by 35%. With that reduction, they were able to increase their participation in the plan from almost 46% to 80% of their employees were able to now offer and accept health benefits. Wow. And at the same time, we were also able to return to that and that franchisor at the end of the first year, $200,000 in unused claims. So if you think about the health insurance world today, you know, it's a fully funded solution where, you know, the money goes in and once you pay your claim or your premiums, those funds are no longer available to you. That's not the case with Seamless. With Seamless, this is a self-funded plan in which all the dollars that you put in to the plan are utilized either for claims, and if after the year is over, the claims aren't hitting the cap of what your premium is, we're actually able to return dollars back to you. And so with this specific franchisor, we were able in this past January to return back to them almost $200,000 that they could then reinvest into their business. So a very innovative approach to the way we do medicine. Of course, all of this is protected by catastrophic stop loss. So that way, in the event if the franchisor's claim fund wasn't able to absorb the cost of the expenses, we have protection for the employer. So really strong plan when it comes to the value of services and accessibility that it offers, but at the same time really provides a way for employers to reduce their cost as well as provide exceptional benefits. So at a high level, that's the Seamless Health Plan. Appreciate you all taking some time to listen to us. Dean, happy to kick it over to you and answer any questions that you may have.
Thanks, Neil. I'll wait for you to stop screen share there. There we go. Gallery. We'll do this. Remove the spotlight. That's great, Neil. I love that, and I love the fact that, you know, you're providing I don't want to say insurance, but insurance fees that people normally pay back to the people, because that never happens. We talk about that all the time. You could be the best driver in the world, you get insurance, you're paying for your entire life. What happens to that money that you've just given to that insurance company if you've never made a claim? So I think that's great. So a couple questions. So when you're going in, obviously, and you obviously know more about this than I do, but most franchisees, just, multi-unit franchisees or even franchisors, we have to provide benefits to our employees. It's just something we have to do. How long does an actual franchisee or a franchisor or an employer in general spend on actually looking at benefits before they decide to go with a benefits provider?
Yeah, I think that's a great question. It's the short answer is a very arduous process. There's a lot of different options out there. I think, the industry has fallen into this trap in which, brokers are generally pushing the highest commission products out to the franchisors. And with that, or the franchisees, I should say, with that, what we found is often what we're seeing in our cycles is that a lot of vendors have been with the traditional plans for the longest time. They're spending, I would say, probably 3 to 4 full-time human resources individuals are probably spending the better part about a quarter and a half looking for employee benefits, rolling out employee benefits, and then administering employee benefits. With the Seamless Health Plan, we feel as if, since this is a standalone product outside of the traditional solutions, we're really able to tailor plans that fit the need of the businesses that we're working for. So what that means in reality is that if you are, let's call it a 1,000 employee shop, and you're okay with the franchisors, the franchisees actually contributing to the plan to reduce the premium that your employees would be paying, we can help create that for you. On the flip side, if you are an employer with, call it a couple dozen employees, that generally the large insurance firms wouldn't want to insure due to kind of the high risk of not being able to spread out that loss, we're able to bring a plan to you that has a high deductible. So that way, at least from a employee perspective, you're able to provide a solution that fits your employees and the specific needs of the demographics of your employees.
Nice. So it sounds like to me, at least anyways, that because of the flexibility in the program that you guys are offering, it's a lot easier for franchisors or franchisees to offer the benefits versus having to go through, I have to talk to 10 different brokers to see what packages they're going to get. And realistically, like you were mentioning, those high commission benefits that they are providing, most brokers are all going to be pushing those same top line ones. They're not going to have exclusivity on a particular line that they could offer the best deal possible. So I love that you can get people their benefits faster, right? Versus, it's going to be 6 months before we have to switch a benefits provider. You can easily go in and swap that out. Can you work in conjunction with existing benefits? Like if somebody's offering an existing package for some or all?
Yeah, great question. Absolutely. We're actually kind of going through that with the previous example. They were a franchisor that just purchased a portfolio of, I believe, like 20 stores, quick service restaurants that they had brought into their portfolio, and quickly found that, this portfolio that they purchased doesn't have health benefits. They saw that they've got a solution in place in which, they offer, let's just call it healthcare plan 1, as well as a whole host of ancillary services, accidental death, dismemberment, all those types of services. And quickly realized, well, out of the 20 stores, there's only 15 people on the plan because they're the highly compensated employees that can afford it. With their model, they wanted to make sure that they provided health benefits down to frontline employees. And what they did is they actually placed the Seamless Health Plan right next to their traditional health plan, and are providing a solution that is significantly more cost effective and attainable for frontline employees, while allowing some of their more tenured employees to stay on their traditional plans due to the multitude of reasons of why people want to stay with existing carriers. Nice.
That's cool. And then obviously with what you guys are offering, are you guys particularly on the concierge service, it offers all sorts of benefits. Like if I pick up the phone and call somebody and I need to get to a medical professional of some kind or a pharmacy, it'll tell me where to go. How often are you guys adding additional medical practitioners or other additional services that, homeopathic remedies or something along those lines?
Yeah, great question. So if you compare the Seamless Health Plan to the traditional plans, we have parity across all of the major modalities and treatment types that all health benefits programs provide today. But I think, one of the things that I think that really is setting us apart in the ability to really help navigate the healthcare network is our ability to bring on new technologies. One of the things, that we're really proud of is that as we work with employers in different verticals, and we find that their patient population has specific needs, we're also able to bring those services into the treatment plan, which eventually would lower the overall claim fund and cost of anything that was charged to the health plan. Example of that is the opioid and addiction treatments that I just mentioned. And, kind of looked at the industry in general. We saw that, with the Blue Crosses and Blue Shields, while they have the ability to pay for those claim funds, we saw that, some of these industries have higher utilization of these types of products and these types of diseases. And what we're able to do is layer in additional care. So that way, one, we can offset any of the costs associated with the care of these patients while providing exceptional care, but then also start identifying potential signals within the portfolio of where we think that these employees may start falling into this trap. So that way we can start going out and doing proactive research into specific markets, saying, hey, we've seen that there's a high utilization of opioids or oxys or whatever drug it is in certain markets. So that way we can proactively go out and engage with the franchisor to let them know that, hey, this is happening in these markets, and it's probably something you want to talk to your employees about before your business becomes involved in this area. So a lot we can do there. Mental health benefits, health and wellness, yoga, just the list goes on and on as we think about specific employers and the types of benefits that they would like to bring on. But at its core, we do have parity across all of the major health plans.
Very cool. Very cool. Well, thank you for that, Neil. I appreciate it.
Definitely.
So